Hello, this is Dr. Gabe from First Look MRI, and this is a 56-year-old female who complains of numbness in her pinky finger, and she also has some pain of her elbow. And they did an MRI here of the elbow. This is short axis views where you can see one view here where fat is bright and fluid is dark. And on this one we have fat, subcutaneous fat is dark, and fluid or inflammation are bright. You can see this white here is fluid. And on this view, since she complains of a pain or numbness in her pinky, we're worried about the ulnar nerve that provides innervation to the fourth and fifth fingers. And so we're going to look for the ulnar nerve. So on this view, this is the medial side, inner side. Here's the outer side. Here's the front. And you can see the biceps tendon right here coming down. And we're going to look on the medial side for that ulnar nerve. So we're going to go above the elbow. And we're going to find this little structure right there. That's the ulnar nerve. This is muscle back here, the triceps. And we're going to follow this nerve down right there. We're going to watch it go across. And right here, this thing poking out, there's the medial epicondyle on right. As it goes behind the medial epicondyle, this is the top of the cubital tunnel, a little channel where this goes through. And in this area, it can be stretched or pinched. Sometimes people can have bony spurs or soft tissue tumors like cysts or solid tumors. They can have inflammatory processes, bony spurs, and any sort of thing that can cause mass effect on here can pinch this. A lot of times it's just related to overuse. It gets stretched as the arm flexes and extends. It can get pinched in here. Sometimes there can be an accessory muscle here that compresses on it, but this is the ulnar nerve. Again, it looks good up here above, but as we go into the tunnel here at the top, it looks good. We're going to go down through the cubital tunnel, and right here it looks a little too plump. As we follow it across, it looks too plump here as well. And now it's coming across here, and now we're getting down out of the tunnel. But there it is right there. It assumes a normal size and configuration. See how small that is there? Now we're going to go back up and see that it is too big right here. So now we're going to look on this view where fluid or inflammation are bright. And we're going to start up above again. There it is, looking normal. Usually the nerves are hard to see. They're not too bright, but when they become inflamed, they swell and can become bright. So there it is. We're entering the tunnel here. Here's that medial epicondyle. There's the nerve. And right here it starts to get a little bit bright. Now it's way too bright, and now it's too big. So enlarged and edematous, or inflamed ulnar nerve. Here's normal again down below. So in the cubital tunnel, we have ulnar neuritis, and this is what we call cubital tunnel syndrome. It's stretched and compressed in here, probably from overuse. I don't see a soft tissue mass, but as a radiologist, we want to see, is this inflamed? And it looks like yes. And the next thing, is there a soft tissue mass or cyst or spur or something compressing on it, an accessory muscle? If we don't see that. They did have a muscle back here that was bright, an edematous muscle, and that may be related to the nerve feeding this, may be injured or inflamed associated with this. But again, this is called cubital tunnel syndrome. I'll put up one more view. This is a coronal view. Here's the medial side, and we see the nerve right here coming down, and it goes through the tunnel here. It's too bright and foggy. This foggy thing here is the ulnar nerve, and then it becomes normal down below. So an example of cubital tunnel syndrome. Sometimes people rest their arm on a table constantly, and it'll put pressure on this. And what can happen is if the pain is not relieved by just wearing a brace or modifying activities, or it can't be fixed with removing a tumor, they can transpose the nerve on the outside, ulnar nerve transposition, and remove it and set it on the outside so it's not pinched as it goes through that tunnel. And that's it, a case of cubital tunnel syndrome in a 56-year-old female. Thank you.